So I'm going to step in here and show you a little demonstration of the quantum and how the quantum works. And so we have here our quantum is to put on a pair of gloves, a sterile technique and a clean environment, a sterile technique and a clean environment. So a pair of gloves, all you need. You have a little square drape, which you can use just with green towels. We're a little bit, more assertive here. And you have this cute little quantum. Can you hand me the M40? So the M40 is a series of 40 bipolar electrodes that will go down 7 millimeters. This is a single electrode. And if we zoom in on that single electrode, come in on the tip here, you can see the bipolar configuration. Proximal is positive. I don't have Parkinson's, I think that's the camera. And the negative is the rounded tip. That's okay, that's okay. And maybe it's a tremor, it is Southern California. And then we have the ceramic interface. That's that polymer that withstands 100 degrees Celsius, just like in the xenon flash lamp. And so that little tip is have a 4 by 2 by 2 millimeter destructive capacity. And so, come back to our zoom out just a bit. We've done our Morpheus already for superficial. I can go through a little access port on either side, and I can treat the entire apex quite simply. And so for an access port, you can use a 16 gauge or a little 11 blade. You want to make sure there's no umbilical hernia. Make sure there's no tissue you don't want to treat on the abdomen. If it's an inner thigh, an arm, an outer thigh, that's not an issue. And you make a little slit, just a little slit. And that was done with local anesthesia. And then I want to make sure she's comfortable. So I lift and I separate. And so I lift and I separate up away from the muscle. In this case, rectus abdominis. On the inner thigh, be gracilis. Outer thigh, be vastus lateralis. Or the tricep on the arm. Lift so you're up and above the muscle. And you simply do some pre-tunneling to make sure she's nice and comfortable. I'm not doing energy right now. I'm just making sure she's comfortable. And it's local anesthesia. She should be nice and comfortable. I'm happy with that. And so now, I'm going to have one approach from this side, one approach from that side to reduce her apex. Now, I pinched about 8 centimeters. So half of 8 is 4, and we know this is about 10 by 10 centimeters. We can calculate how much fat we can destroy or go to our pinch pulse table. She pinches out, so this is going to be about 300 pulses. We're going to do 150 deep and 150 superficial. Deep is at my thumb on my index finger. I'm lifting up away from the muscle. So 150 deep, come out, and then 150 more superficial, but not up against the papillary dermis. Really simple to do in your side office. Where there's a submentum, which I'm going to show later this afternoon, jowl, nasolabial fold, tomorrow, you simply do some pre-tunneling, set the right energy, and you have, of course, your microphone ready. And the foot pedal, well, you usually need to have it ready so you can capture this. And where's my foot pedal? Perfect. Okay, and so now we've done our pre-tunneling. I'm lifting up and I'm protecting. And I'm doing energy of 10. Come on in so we can hear. Come on in, over here. Come around the side of the table, other side of the table. Come on in. There we go. I want you to hear the pop, pop, pop. Don't go in front of the camera. Come from the top. There you go. Beautiful. Can you hear that pop, pop, pop? That is the sound of dead fat. That's the sound of 4 by 2 by 2 millimeter zones of ablation coagulation. That's the deep Morpheus effect. I'm not lipoing this. I'm not removing it. The body will do that. How many pulses? 25. Perfect. So we're going to do about 100 pulses at this level, which is right at the tip of my thumb and my index. I'm up away from the rectus abdominis, so I'm staying subcutaneous. I'm doing about 1 to 2 centimeters per second. How many? Yep, tell me at 100.